Hi, I'm Christina Trauthwein, VP of Content and Creative for Hotel Business and Inspired Design. Welcome to our virtual panel series, Hot Topics. Today's session is Getting Back to Well, Restoring Consumer Confidence in Travel. Safety has become the new loyalty program for winning customer trust and continued affinity. This Hot Topics session will discuss, among other things, best practices and procedures for creating and communicating health and safety protocols to instill consumer confidence in travel and the central role technology will play in these efforts. Today, I'm joined by a panel of experts who will shed some light on the topic. They are Peter Scialla, COO of Delos, Elie Khoury, he's the EVP of Operations at Aimbridge, Sue Spinney, VP Global Ground Transport at Expedia Group, Barb Spurrier, Executive Director, Well Living Lab, which is a Delos and Mayo Clinic collaboration, and Dr. Zachary Pope, Research Scientist, the Well Living Lab. Let's just take a minute to go over the format. The session is an hour long. Each panelist will provide a brief overview of their work. I'm going to moderate the session with questions for the group of panelists, and I'll leave about 10 to 15 minutes at the end, providing an opportunity for attendees to ask the panelists questions. So please type your question in the Q&A box, not the chat, and I'll try to get to as many as possible. We will be covering this Hot Topics session in the May 15th issue of Hotel Business on hotelbusiness.com, as well as via social media on LinkedIn, Facebook, and Twitter. This session is being recorded and will also be soon available on demand online. Also, before we start, I'd like to take a moment to thank our partner for today's panel discussion, Delos. We're honored to collaborate with the company to provide you this pertinent and timely information. So let's begin. We're going to take a few minutes for each of you to introduce yourselves and tell us a little bit about what you do and your work. And Peter, we're going to start with you.
Good afternoon, everybody. It's a great pleasure to be with you. It is interesting time, obviously, in the hotel industry. Delos is a company that operates at the intersection of real estate and the health and wellness industry by focusing on the effect that buildings have on the occupants of these spaces. We made an observation almost a decade ago about the green building movement and all of the wonderful work that had been done and is still being done in regards to the effect that buildings have on the health of the environment, and noticed a real vacuum in thought and an opportunity for us to create a body of work that focused on not just the effect that buildings have on the environmental sustainability, but the effect of human sustainability and the occupants inside these spaces. You know, look, we spend over 90% of our time indoors, whether it's our homes, our schools, our offices, our hotels, and the 15 cubic feet that surround us is having a profound impact on our human health, performance, and productivity. We ultimately codified this work into a called the Well Building Standard, launched in 2015, and has since become the world's leading global certification program for healthy buildings, encompassing about 2 billion square feet at this point across 80 countries. It has been a difficult year in so many regards, and about a year ago, industry groups and property owners approached us through our subsidiary, the International Well Building Institute, and asked us if we could take a portion of the well building standard in that body of work and create a designation for spaces of all types in regards to the great work that they've been doing on health and safety. And so we did establish the Well Health Safety Rating last year. It has been adopted by tens of thousands of buildings across the world. And thankfully, we have been able to be a part of the solution in creating transparency and visibility to industry groups and really driving consumer awareness towards the third-party validation of the great work that's being done in health safety as a category. You know, the part of our organization focusing on the ratings and the standards is the International Well Building Institute, which is a Delos subsidiary. And the rest of the organization has spent the last 6 or 7 years focused on solutions and technologies that can be implemented into the indoor environment excuse me, to create healthier spaces. This includes air quality, water quality, obviously things in the lighting category for productivity and sleeping patterns, acoustics, thermal, everything that affects the human body. I would say that since last year, the market has gravitated very quickly to a desire for companies to become wellness oriented. The good part about that is raised awareness about the effect that spaces have on people and what we can do to improve those spaces. One of the negative artifacts is there is a lot out as it relates to noise and technology and claims. We are in the business of separating fact from fiction. We rely on science and third-party testing and the solutions that we have been able to help procure into some of the largest school systems in the country, and of course into hotels and every typology, especially in air quality at this point, is so critical because we know that this pathogen will hopefully come and go. There will be future viral concerns, but health safety as a category must rely on purified air, among many other things. We know that instantly at the outset of the pandemic, everybody sort of ran towards the cleaning wipes and the sanitization of surfaces. The last year has taught us that this is not just a surface contamination issue. This is an airborne issue and a behavioral issue. And as I survey the great work that the industries have done, especially as they're submitting documentation for review for the Well Health Safety Rating, I am incredibly impressed about the response. There has been great work, and we need to now instill that confidence into the consumer to let the consumer know that that has been verified. And third-party verification at this point is something that's key, especially in building consumer trust. So thank you, and it's a great pleasure to be with you, everybody.
Great, and we're going to get a little bit more into the technologies and indoor air quality and instilling that confidence. So thank you for that, Peter. So Elie, a little bit about you and why you're here.
Good afternoon. Thank you for the opportunity. My name is Elie Khoury. I am the EVP of Operation for Aimbridge. Aimbridge Hospitality is a leading global third-party hotel management company. We operate over 1,550 hotels in 49 states and 22 countries, with 70 lodging brands under management with us. We represent a absolute number of independent hotels along with the brand name hotels that we operate. Truly, our mission is to be the best hotel operator by leveraging our scale and provide value for hotel owners and opportunity for our associates. I will say to you that we worked hand in hand with Peter and his team to develop a program, a third-party recognized worldwide program to introduce to Aimbridge and to our hotels, mainly to build consumer confidence. As people start to travel little by little, we want to make sure we have a program solid and an influential program to provide safety and promote consumer confidence. And more importantly, we wanted a program also for our associates. We wanted to make sure that associates come to work in this pandemic and who are frontline employees and servicing our customers and putting, some of them putting their health at risk by coming to work. We wanted to make sure that we're providing safe environment for them, promote loyalty, and make sure that we're providing the safety necessary to operate in the pandemic. So hence we're over 400 hotels under the program and continue to build and certify and provide the rating for more to come. Hopefully we can get all our hotels on board, and by sheer of volume and the size of the company, I think the Delos and their HSR program is truly about not only serving into the pandemic, but we truly believe that has a longer runway, and post-pandemic we think the program is very valuable and continue to promote consumer confidence as important, because I think we have educated the customer and the consumer of how to behave, and I think having a program like the Well program is really going to help us continue to promote and get people traveling again.
Great, and we're going to get a little bit more into how you're messaging and promoting the message of safety. So let's go to Sue. Just a little bit about yourself. Thank you.
Hi, everyone. So I'm Sue Spinney. I've been with Expedia Group for almost 20 years. Most recently, since the beginning of COVID, I've been running a global ground transport division, focusing on car and rail and working closely with the partners in the industry. I just want to say it's really been great to see the synergies between all the different lines of business, as well as the various opportunities on this side and how everything comes together. So thanks for having me here today. I'm looking forward to the discussion.
Great, thank you so much. Barbara?
Great, thanks so much. It's really, really nice to be with you today. My name is Barb Spurrier. I serve as the Executive Director of the Well Living Lab. I have the privilege of serving in that role. Prior to that position, after graduate school, I had a number of positions. I served at Mayo Clinic. My last role was helping to build a capability of innovation across Mayo, and I served in that capacity for about 10 years. So very much about how can we advance the core value of Mayo Clinic. The needs of the patient come first. And I think, like all of us, how can we do a better job of serving our primary patient, customer, whoever that is for our various industries. For us, it was a lot about building human-centered design and new models. So things like telemedicine and wellness, how can we really connect with the patient, connect with the person, and think about transforming health and healthcare. One of my roles was thinking about new kinds of partnerships as we tried to advance that core value of the organization. And along the way, I met Peter Scialla and his brother Paul Scialla, and we started to dream about the idea of a well living lab. So how could we bring the strength of Delos in building science and building wellness with Mayo Clinic as the number ranked hospital and healthcare system, and clearly a background in health science, together. So bring building science, health science together. And that was over 5 years ago then that we opened our Well Living Lab. Our Well Living Lab is located in Rochester, Minnesota, adjacent to the campus of Mayo Clinic. I think it really shows these kinds of new partnerships to transform our work in our industries. We have a team of over 20 scientists, analysts, technologists, a collaborative model with Delos and Mayo Clinic, including things like a scientific advisory board that's chaired by a Mayo Clinic scientist, things like our Well Living Lab Alliance that brings in over 20 companies that really are committed to transforming our work in building health and wellness in the indoor environment. So like the rest of the world, last spring, we pivoted and we said, how can we be most helpful in taking our capability of the Well Living Lab, which is a simulated environment completely committed to advancing, again, the human-centered health and wellness. So everything we do is human subject research. And right now our simulated environments that can be reconfigured include offices and homes and now a school, with everything supported by the Mayo Clinic research environment, the Mayo Clinic Institution Review Board and such. So we took that capability and we said, how can we help? And we launched our Well Living Lab COVID-19 and Beyond research program, not just for offices and homes, but also thinking about other indoor environments like hotels, schools, offices, homes. And I'm really thrilled to be here today with Peter and our lead scientist of our Well Living Lab COVID program, Dr. Zachary Pope. So thank you.
My name is Zachary Pope. I'm a research scientist within the Well Living Lab, also an assistant professor at Mayo Clinic. Before this, I had a wealth of experience in exercise physiology. When I went to do my PhD, I really expanded into community health and running community-based trials. But near the end of my PhD and all throughout my postdoc, I actually did a lot of environmental sensing work and some really interesting studies. And so kind of just was almost this natural fit coming to the Well Living Lab. And just like so many of us, March 2020 hit like a freight train. Like everything kind of closed down, and there was a definite need in the market to really address some of these unanswered questions. And I feel that we have done that and are actually currently still doing that with the COVID-19 and Beyond research program within the Well Living Lab, really looking at it from all aspects. So both airborne and surface transmission, as well as looking at these behavioral aspects. It's been hard on a lot of people, and we want to know how to help. Again, what Peter said is so salient. It's the separation of fact from fiction. People want to know when can I travel again? When can I be in a hotel again? When, is it safe to rent a car? So these little questions mean a lot to a lot of people. And so I'm just really excited to be here today and to be able to contribute what I can to the conversation.
Great. Thank you so much. You all provided such great information. I hope there's a lot left for conversation. As you mentioned, 2020, March 2020, everything turned upside down. And here we are in March 2021 now. So let's talk about the importance of health, safety, wellness protocols and programs to increase hotel guest and meeting planner confidence. As we move out of the pandemic crisis into recovery mode, and the leisure travel begins to pick up pace, it's increasingly important to show a commitment to that health and safety. So what are you doing to show that commitment? What are some of the initiatives out there? Anybody can start.
Yeah, I can start. I think it's interesting. The pandemic was devastating for the hospitality industry. So it really hurt us pretty badly. Ambridge had 65,000 employees. I wouldn't dare to guess how many we have now because of layoffs and some of the opportunities. But I tell you, we start to feel we're coming out of the opportunity here. We're coming out of recovering. Start to feel good in the first quarter. Looking at the horizon, we see there's definitely an uptick in our reservations, and leisure travel is up. Groups start to take action. We're starting to see some interesting dynamic on the group business. We're seeing some what we call the hybrid meetings now. Everybody's calling the hybrid meeting instead of just the virtual. So that's a sign of good recovery. But what's more importantly, I think we have educated our consumer and our customer today of how to behave safely, and the wellness is so important. A lot of the companies, a lot of the brands, a lot of hotels has touched a little bit on the wellness through some health programs. I think now it's more important to focus a lot more on that by providing a more safer place to be, safer place to stay. At the same time, continue to focus on employees and associates. So the program, what really is going to work well is, how are you going to promote the wellness? How are you going to promote safety and health in the buildings? And how are you going to continue to recruit and bring people back to work? Because that's the number one challenge today, is as we start to recover, is bringing those folks back to clean rooms or work at the front desk. So I think that's where the key opportunity for us is, engaging those things. At the same time, technology is taking a different role. We're seeing a lot more opportunity with technology. The brand started doing that a few years back. It's more important today. We're seeing that the customer we educated the consumer when they come to the hotel not to go to the front desk and touch everything. So we've got those plexiglass and I think the consumers now really engage more on technology. We're ordering through QRs in the restaurant. Technology is starting to show in the hotel business. It showed in the travel, in the airline a couple of years back, but now it's more prevalent in the hotel business. So we're seeing the brands really pushing harder on those technology by keeping the guest at a distance for the process, and still provide the services at the desk, and the hospitality performance needs to be there. But more importantly, how do we give the consumer power to choose and power to skip the line and go straight to the room?
Okay, so we're going to get a little bit more into employee safety, but let's talk about the guests. So as you mentioned, communicating these initiatives to guests is critical. So how is the industry as a whole working together to support that messaging? And even Sue, you have that guest in the car maybe before they're at the hotel. So how is the messaging going out?
Yeah, and there's a couple things that we've been doing at Expedia Group. Before customers are arriving anywhere, they're shopping, and we want to make sure that we're doing a great job at helping our hotel partners, our car partners communicate. So some things in terms of highlighting the different measures that companies are taking with tags such as enhanced cleaning or adding modules in our shopping path. But it is really about making sure that the communication piece is happening. And then on the car side, we worked really closely with our car rental companies to launch new features such as online check-in, pre-registration, or skip the counter. And those do allow the customers now to either skip the counter altogether or have less time at the counter. And I think any one of us that has rented the car over the course of years, you know how long that process can take. And it's more important now than ever to help customers ease through that and bypass the concerns around health and safety.
Okay. Peter, how is Delos helping to support the message in the industry?
I think it's all about transparency and accountability, right? I think the consumer wants to trust that not only statements have been made as it relates to best practices and safer spaces and more healthy spaces, but that there's been validation and transparency as to exactly what has been done, and are these claims being made by the stakeholder that's making them, or have they been vetted to be properly mapped to science and checked in that regard. And I think the messaging can be further enhanced as we're putting a lot of investment behind raising public awareness for not only the concerns, but what to look for in addressing those concerns. When it comes to the Well Health Safety Seal, we've got behind a big marketing campaign and have engaged some celebrity sponsorship to make sure that we're socializing that message to the public to look for the Well Seal and feel better going inside when you see the seal on the outside of a building. Now that all relies on, of course, the underlying program having integrity. And the process by which we informed this body of work was not just one organization coming up with a group of protocols, because the industry has done such a wonderful job. I think we effectively called on virologists, public health experts, industry practitioners, and expertise in each industry sector to shape a program that is rich in integrity and backed by science, but most importantly in this regard can be communicated in a very effective and simple manner.
Right.
This is what the guest is looking for, and I think that messaging is key. Again, this all comes down to the transparency of what's been done and having it validated.
Right. And certainly travelers seek reputable sources to help them figure out the smartest ways to travel and look for that. A large part of hotels' demand is tied to corporate travel and in particular meetings. What are some of the keys to providing confidence to this critical segment of business to let them know it's safe to return to in-person meetings? And I know we touched upon cleaning and air filtration, almost like the new amenity. Is there a standard being created?
I'll jump in on that one. There are a number of air standards out there. There have been, the air filtration technology. That this is not, brand new science or brand new work. I will say that what we have observed is there are certain standards that test the filtration efficiency of a filter. What we have learned is that testing a filter that goes inside an air handling unit can be effective and certainly informative. But relying on tests for the actual unit itself with the filter inside is probably the best way to get certainty as it relates to what the outcomes are. Look, there's so many things that change between one filter in one device and a filter in another device. And a HEPA rating on a filter is of course a wonderful standard, testing down to 0.3 microns for very, very high efficiency. COVID is much smaller than that, but they still will have efficiency in that regard. But if the filter is placed inside an air handling unit with variables such as pressure drop and the dozens of other things that can affect the actual efficiency of the unit itself, we have relied on testing for the unit in its entirety, not just the filter. And in fact, we were commissioned by the New York City public school system to prescribe and procure safe and effective and very scalable solutions to be wall mounted into their classrooms. New York City was first. The public school system of Chicago followed. Boston, Miami-Dade, Baltimore all followed with the same technology. It checked the box on efficiency, on scalability, on size, on sound, and we have effectively helped procure over 100,000 of these devices into school systems. the fact of the matter is that every typology, including hotels and especially meeting spaces, could benefit from the same technology. This is not about putting a HEPA filter in the ceiling. This is not about ripping up HVAC. This is about putting something on the wall that's visible, so you get that marketing power. But the science actually tells us that the wall-mounted units, while much cheaper and much more effective, as long as the right technology is being employed, are actually more effective than doing something in the HVAC. You've got contaminated air in a classroom or in a meeting space, and if it gets contaminated and goes into the HVAC, there's a lot of contamination that can happen on the way to the filter, as opposed to putting devices as close as possible to where people are sitting. I think air quality is key for meeting spaces. I think that is probably one of the highest risks of transmission, even if folks are sitting 6 feet apart and doing the right social distancing. So I would certainly lead, of course, with sanitization, but increasingly more focus on the air quality of these meeting spaces, circulation, ventilation. There's so many ways to go about it. It's about choosing the right technology that doesn't have any harmful byproducts.
Okay, Barb and or Zach, do you want to jump in on that a little bit?
Sure, that's great. Thanks so much. I think so for the Well Living Lab, our mission is transforming human health and well-being in the indoor environment. And I think the whole notion of transforming anything, we can't do that alone. So these new kinds of partnerships and collaborations are so important. For us, that of course is Mayo Clinic's right in our backyard, and the work that's been going on over the last year with Zach's, Dr. Pope's leadership and our other scientists, working with Mayo Clinic, infectious disease, virology, molecular medicine. Zach can tell you a little bit more about that. And now bringing in the University of Minnesota as our first external academic collaborator. And what we try to do is say, what are the unanswered questions? To Peter's point, there are a lot of unanswered questions. So what we invest in is we think about what's desirable, what does science need us to do, and what do people need, what's viable, what can be informed by the assets of Delos Mayo Clinic and our collaborators, including our Well Living Lab Alliance partners, and what's feasible in terms of technology and where that can take us. So all of that is really important, but it really centers around the unanswered questions of science and doing the literature reviews and such. Everything we do, we share publicly, and we go forward with peer-reviewed publication. So I just wanted to share that in terms of our approach. It's about sharing. It's about making it transparent, to Peter's point. But Zach could tell you a little bit more about the research we've been doing and what we've been learning.
Yeah, thanks, Barb. And yeah, I'm seeing some of the questions that are coming in, which are all great, by the way. So keep those coming in the Q&A. I think that to some of these points that are brought up, and just kind of pulling back out, if you will, on the COVID program, it's 6 interrelated projects, because this is a multidisciplinary, it's a multifactorial disease that we're talking about here. But even though it's COVID right now, you can really extrapolate this to any type of respiratory illness. And so what we're trying to do is really give voice to actionable items that are born out of empirical research. So, we as scientists, we have to go in, and to Peter's point, we have to be able to validate what we're working with. And to Peter's point, source control is ultimately the most important thing about any type of illness. You have to, you're more likely to mitigate transmission with source control. And so being able to then use the resources that we have at our disposal to work with the University of Minnesota, to work with Mayo Clinic, et cetera, to assess these different unanswered questions and really develop them and drill down as deeply as possible to then turn around and inform people with actionable items has been really important to us. And with all of that in mind, I think that Christina, I don't know if it's okay to, because this relates to some of these questions that have been posted. Do you mind if I say a couple of things?
Yeah, that's fine.
Okay. Yeah. So I think that, one of the things that's posted here that was talking about, soft surfaces versus hard surfaces. It's obviously much easier to disinfect a hard non-porous surface than it is a soft surface. So to just address the question simply that was posted here, the study out of the UK, talking about pathogens living in fabrics for up to 3 days, that's very true. But the fact of the matter is most of the things listed here can be washed quite easily, in just your regular washer and dryer, and you're going to take care of a lot of those factors. But really, when we start thinking about the longer term approach here, if you take care of the air, you kind of take care of the surfaces too. And so that's why when we kind of draw back with regard to COVID, that the air purification, really thinking about what source control looks like in that way, beyond mask usage. We know that mask usage is critical, but beyond that, what can you do to take care of the air so that you aren't having to worry all the time about the over cleaning of surfaces?
And can I jump in here for a second? I would love, the science is so important, and Zachary and Barbara really hit home on how we need to behave and what we learned in the last year. And Sue made a comment earlier about rental car. In the hospitality business, we learned quite a bit from the rental business and the airline of how technology is really the way it should go, while we keep the hospitality and service aspect intact. So we want to continue to provide the hospitality, the hotel services, while using technology. It's really component. And Peter made a comment about the air filtration. But in meeting spaces, we still think it's important to have the consumer confidence and be the theater of the cleanliness should still be there. We should be presenting and showcasing how we're keeping the guests and the associates safe, on top of science and on top of having the right equipment to filter air. But seeing how you're cleaning and wiping, having the disinfecting stations, sanitizing stations, having the food service done differently, using hybrid technology instead of virtual technology, while showcasing that we're being thoughtful about their safety. It's hard to tell who's vaccinated and who's not, so you really cannot relax those standards. We see a lot of states are opening up. Great for the economy, great for business travel, but as soon as they walk into the hotel business, we still have to keep our guard up a little bit to showcase that we are thoughtful of their health and safety. But I think we learned quite a bit from the pandemic, and I think our other countries have had this pandemic on and off, and they continue to wear face covering, whether it's required or not. I think we're going to see quite a little bit of that, and I think we need to continue to create the theater of what science is all about, and how do we provide that to our guests, whether in the meeting space or in the guest room. Having as simple as the seal at the door that the room's been disinfected, nobody has been in the room since we cleaned it, is great. And giving the guests the power to choose if you're going to enter my room or not, that's an important piece. Opt in to what we call the stay over cleaning. It's the power of the guest. It should be their decision, not for us to go in there and start cleaning everything, touching everything. I think that's what this pandemic has taught us. And I think we're gonna see the hospitality business in a different light. We're gonna follow the technology of everybody else, but add some more touch points that we have missed in the past.
Okay.
Yeah. Can I just add to that too? I think what's interesting is we're trying to communicate all of this, then we have to deliver it when they show up. But it is showing up more in our reviews. Health, safety, even smell is showing up more. So yeah, they're going to hold us all accountable.
Absolutely. And I know we're talking about, air filtration and certain touch points and everything, but let me ask you this. Will there be more of an emphasis on offering COVID-19 testing for let's say, for meeting planners to help encourage safe meetings, or on vaccinations? Are there any incentives for guests and employees to do this?
I'll jump on that real quick, because we are providing, we're offering testing for group business. We signed with a national partner that covers all our hotels, so we want to provide that. Whether the guests, participate or whether the group wants it. I think it's important to provide the services. There's a lot of legal, aspects of that. We're debating it on the legal side, whether we should enforce vaccination. Can we enforce vaccination? Is there a law against it? Can we do it in the workplace? So what our approach has been, let's make a strong recommendation. Let's use education and communication to promote vaccination and testing for groups. So we're offering vaccination. We're also incenting associates to get vaccinated on top of education.
Okay. Well, let me ask you, do you think we're headed towards requiring proof of vaccination to travel or stay at a hotel?
I will answer from hotel perspective, and I'll turn it over to Barbara and Zach and maybe Sue. But I think more importantly for us, it's very difficult, and we're not sure if we're going to be allowed to do that from a legal perspective. So it's a slippery slope. So that's why I think it's one of those opportunities we want to encourage, we want to incent, we want to promote as hard as we can, we want to educate as hard as we can, and we'll figure out in a short time if it's going to be required, legally required, if you're going to have to travel. I know some countries do that. You know, you can go to some certain countries, you can't go in there unless you have certain vaccination. You know, a lot of immunizations in different countries are expected. Not quite sure how we're going to end up here.
Okay, I would like to actually hear from Sue and Zach and Barbara on this, and then I have a follow-up question to this. So go ahead, one of you, if you'd like to.
So I can jump in. You know, from our perspective, you know, I think requirements are going to continue to change, and we're going to stay committed to supporting frictionless travel experience for all our travelers. For us, it's really collaborating with the various stakeholders as they explore and adopt these certification tools and processes. And then we're going to have to work with them closely on determining how to best integrate all this industry standards and new standards into our products.
Okay.
So I really agree with the comments that have been made. I mean, for us in our lab, we're in close quarters. We're opening up our human subject studies again. And we decided that we're requiring that our human subjects are vaccinated. It's the safest thing to do at this time, but to the point that we keep learning about this. In fact, Zach and I were just discussing this morning an article that just appeared in Nature. So Zach, maybe you can highlight things, but I think it's a complicated, discussion, and we have to keep learning about this to think about, how the requirements will take shape.
I mean, I wish there was an easy answer to this question, and there really isn't. Within our lab, as Barb mentioned, it's really important because there's so much contact going on. To do our studies, it's necessary. But in the hotel or the rental car industry, it's completely different. And there's a very interesting bioethics discussion that's going on around this that really talks about if you do require vaccinations, for instance, even just to travel internationally, or to do certain things even domestically, you risk increasing inequalities, whether that's social inequalities and unfortunately racial and ethnic inequalities, given the larger discussion around COVID-19 that's happened over the last year. And so the question becomes, to me, at least from my perspective as a scientist, really, okay, how do we deal with controlling mitigation as close to the source as possible? And then from there, and this is definitely something that I know I have to constantly work on, being able to communicate that effectively. Because as scientists, I could sit here and give you all the methods in the world, but it's just not of interest. It's people want to know what you're doing to protect them. And at the end of the day, in the hospitality industry, that's what matters.
Isn't there also maybe like a privacy issue though? Will travelers need to give up a little bit more personal privacy in exchange for more freedoms and assurances that their health is being protected, whether it's through contact tracing or vaccine checks or whatever it may be?
For sure. And that's actually part of this larger bioethics discussion is, what degree of privacy are people willing to part with to help with safety? And again, I wish that there was an easy answer, but there's not. And I think we all have to use our best judgment. And really, when you think about this from the business perspective, what's the market telling us? So, Elie and Sue, and obviously Peter as well, they know what the market is saying, what people are looking for. And maybe it is just as something as simple as a seal. I've seen I just used the MSP airport here in Minnesota as an example. They tell you this room was cleaned X number of minutes ago. So things like that, while they mattered prior to COVID, they matter a whole lot more right now.
Yep.
Right.
And for us, if I wish we can have a sticker at the window that says everybody's vaccinated in this building, right? But unfortunately, there's a lot of legality and a lot of privacy issues that we have to overcome. We've been struggling with COVID, with the testing, if we can require it. How do you manage it? Are we allowed to, if somebody doesn't want to do it? The same thing with the vaccination. It's always more powerful. But I would say, with the HSR program, the seal is at the on the front door, and I think that's really helped us quite a bit. We've got stories from our general managers telling us how they're able to book business out of the program because of that QR code. We talked about communication earlier. How do we communicate? I think the Uber industry, and the Lyft and the rental car industries have done a great job on their apps telling all the safety component. With the Well program, you get the QR, we click on it when you walk in the building to understand what is that seal really meaning on top of the national campaign. It educates people. So we need to continue to educate as hard as we can to build that confidence back up. I personally, we don't like the virtual of anything or the hybrid either. But at the end of the day, I think that's the component we need to do. So the harder the industry, in conjunction with the American Hotel Lodging Association, campaigning our government to explain and promote as much as we can, we've got to get back to get the people travel, enjoy the vacation, and be able to stay at hotels at the leisure and have conduct business and group business. So I think that's really the key, is communication and education.
Okay. And if I might just jump in, an observation from, sitting at the nexus of many different industries. Elie and the Aimbridge group were prepared. They were able to mobilize, as Elie said before, 400 hotels through the system because of Elie's leadership and the organization having centralization of policies and protocols and using that and applying that, downstream to each hotel. So that is obviously a tremendous achievement, but the scale with which they've been able to do that quickly should be setting an example for the industry.
Yeah, and I'll comment on the car rental side too. I'll speak for them. Obviously, with the expected 3 times more travelers renting cars or driving versus what we've seen pre-COVID, the car rental companies did adapt very quickly, and we've seen things like Hertz had the Hertz Gold Standard pledge, Enterprise with their Complete Clean pledge. So definitely saw them move into action very quickly to offer that assurance.
Right. And that's so important. As we said, communication is essential. And we're talking a lot about a communication with the guests and with travelers, but it's not just with guests, it is with staff, as you've touched upon before. So how is the industry investing in engaging with associates during the crisis to support the teams and help them through rebounds and recovery? Is there associate training? What are you doing?
At Aimbridge, we've been out there. We started the pandemic. We have daily calls with our general manager to walk them through the initiatives that needs to happen at the property to deal with the pandemic out of the gate. And halfway through summer, we start working with Delos, trying to get a third-party program on the well into our building so we can continue to educate our associates. So part of the program for Aimbridge was, it's important only to build consumer confidence, but the associates and our associate confidence in coming to work. So the program also promotes and educates and help making sure that the associate is trained on all the components of cleanliness. Aimbridge also launched what we call the Aim Clean, that's part of the Well program. which is all the disinfecting and the sanitizing of the guest rooms and doing the right thing, and making sure the associates are wearing the right PPE, and making sure that they're being educated and keeping social distancing and showcasing that we're thoughtful of them. Sue mentioned earlier, how do you communicate and mention that it is about telling of all these different programs, a rental car company. Hospitality is doing the same thing. All the brands have their own cleaning process. They're all similar the same. They focus on some product that's necessary in the guest room, which I think is going to continue to be in the guest rooms for a while, whether it's using Clorox or using wipes or using seals. I mean, I think that's needed, and I think those things will continue to stay part of that we have educated the consumer and our associate. Our associates are coming to us and saying, hey, if we don't have disinfection or we don't have sanitizing station available, we don't have the product, it's a problem for us. So I think they've been educated also. But we do something in Aimbridge, which is very powerful. It's called the Power Hour, where we bring all the general managers into a virtual call. And we did it 7 days a week at the start of the pandemic, where we're really sitting there and educating every single day what do you need to do. And as we learned from the CDC and how things were evolving and the science is changing, and so that was our way for us to communicate to our associate as large as we are using our scale.
Okay. And as we know too, I'm looking at some questions coming in from the audience, and this is more of a statement than a question, but we still talk about it. Consumers talk to other consumers. Sometimes that's the biggest communication out there. And someone here wrote that, sticker and awareness is great, but travelers are going to use reviews to test the credibility prior to booking and also arriving. So what are your comments about that, about the review process and making sure that, good reviews are left and guests are reassuring other guests?
So
Yeah,
go ahead, Sue. Go ahead, Sue. I'm sorry.
I touched on reviews a little bit earlier. I mean, it's something that's very important on the Expedia platform. And we've been I come from the lodging side, so we're working closely with our hotel partners for many years of when guests check in, we send real-time review feedback that allows people to get ahead of potentially a negative review, and we really encourage our partners to use that. And then responding to reviews once they're published, I think that's really important. So paying attention to that and continuing to respond and communicate is critical, I think, at this time.
Right. Okay. Anybody else want to say anything?
On the review side, I wanted to, so our customers today are more vocal about cleanliness and sanitizing than ever before. So they'll be the first people to tell you if you are doing the right thing or not. And I think it's so important to pay so much attention to that. Before we were focusing on are we serving from the left to the right and all those. I think now we're going to focus on more health and wellness. We got to pay attention, and we need to make sure that when you enter a room, nobody has been in the room, and nobody goes in the room after you enter, providing that safe. And then people will let you know if you're doing the right thing. So reviews will be the most dominant thing. We're working with Expedia with the help of Delos and their group to make sure that the seal is on the Expedia reservations. And we're working with some other partners out there. And from a brand perspective, the brand have this cleaning processes and their brand standard, who they're doing in turn, telling the customer of the cleanliness. And we're adding to it the well program to the booking engine. So I think that's where you really need to, if we miss that third party accreditation, I think, or miss telling the customer we're doing all that, the customer is going to go somewhere else.
Okay. We only have a few minutes left, actually, so I'm just going to go to a question from the audience, and this is specifically for Ambridge. Will the owners and investors be paying for the cost of any programs? Is it an opt-in program for Ambridge owners?
So yeah, so we signed all our hotels into the program, and we're rolling out hotels at a time and group of owners at a time. We have spent time educating, so it's not necessarily a force-fed program for our owners, but it is an education program. Paul was on a call with me a couple of days ago on a large group of hotels, over 165 hotels for one ownership group. I think the more you educate the owners, they're all signing in. I have yet to have any owner that I have approached or talked to has said no to it, because they're starting to realize the power of the third-party accreditation and the rating, and they're starting to see what it does from an ROI perspective and building that confidence, consumer confidence to book a room reservation. I don't think we will have any issue continue to ask our owners to sign up. But yes, we are given the option, like we give the guests the option, we give our owners the option if they want to participate or not.
Okay. Okay, so guests' expectations on health and safety and wellness are obviously going to remain post-pandemic. So how are we addressing this beyond 2021 for the overused phrase of the new normal, but what are new technologies maybe that are out there on the horizon that we haven't discussed today that maybe that's in the works?
Maybe I'll jump in on that one. So when we when we first looked at the hotel sector many years ago, obviously pre-pandemic, it wasn't just about air quality, and wellness as a demand driver had some legs. Going into COVID last year, we certainly saw that there was a sector of the traveler that was seeking out not just clean and safe rooms, but the wellness experience, right? The good night's rest, obviously anything else that can be done in room. We had spanned through our Stay Well program across 16 different product categories. Beyond air filtration, we looked at mattresses that don't off-gas. You can't clean the room and profess purified air and then have a mattress in the room that is off-gassing chemicals when someone's sleeping on it 8 hours at a night. Look, lighting that can have profound impacts on human health and well-being, including increased productivity and, of course, great sleeping patterns, but equally, proper circadian cycles through indoor lighting can help reverse some of the effects of jet lag, right? Something that resonates with travelers. So when you think about, the health safety category, that is the tip of the iceberg. And I think that the hotels that are going to benefit after things revert to normal are the hotels that not only have done the right thing, gotten the third-party accreditation, of course, naturally have shown leadership in that regard as far as cleanliness, health, and safety. But the differentiating factor after everybody has done that are going to be the hotel groups that take a bigger bite out of wellness as a category. And they start to think about, okay, what else in the category of wellness can I message to my hotel guests that I'm serious about their health and wellness? This wasn't just a response to health and safety to stabilize occupancy, but rather, and hopefully, knock on wood coming soon, a marketplace whereby going deeper into the wellness categories and looking at circadian lighting and looking at things that can be done in the room beyond air quality will start to drive rate premiums again. And wouldn't that be a wonderful world when we could start creating the wellness experiences across sound, sleep, nutrition, mind, body, all of these things. There are technologies that exist. There was a certain segment of the market that was asking for those and paying premium for those pre-COVID. I believe that coming out of this pandemic, that will be the differentiator with hotels, not just the rating. The next step will be, yes, we care about your health and wellness. We've gone further than air quality and further than surface sanitization. It's going to be an exciting time.
Yeah, I think so too. I agree with you on that. Okay, we have 4 minutes left. So this is the question I'm going to end with. And maybe Zach and Barb, you can talk a little bit about this. What does the science tell us about the future of the virus? You have any information on that?
Over to Zach.
Yeah, so the future of the virus. So I just want to say one thing. I have answered at least one question privately, just in case we didn't get time to answer it. But it was about, yeah, but the future of the pandemic, just given the way in which the SARS-CoV-2 virus that causes COVID-19, how it behaves, it's likely going to become endemic. So it's likely never going to go away. It's going to be like the seasonal flu. We're going to see upticks throughout, the change of the seasons. So spring and summer into fall, lesser transmission. Then, late fall, winter into early spring, you're going to see an uptick in transmission. A couple things work in our favor. One, a lot of the stuff that we've talked about here, these solutions are here to stay. Two, we have vaccinations and we have really good preventive measures that are on the way as far as pills and other pharmaceuticals that we'll be able to use, much like Tamiflu is used for the flu. And so I think we need to switch our paradigm to when is this pandemic going to end and into when are we going to get back to normality? And the most current data suggest that that's likely going to come mid to late summer, where we're going to see things resemble kind of what we call quote unquote normal. And it's going to take time, but vaccinations help. And I think because there's been this groundswell of scientific effort put behind all of this, I think that we are probably in one of the best positions for a single virus that we have been in a long, long time. And that's both on the pharmaceutical route and the vaccination route, of course, but also on the solutions route, which again, as I said earlier, very much transcends COVID and goes into all respiratory illnesses.
Thank you so much for that, Zach, that explanation. So it's just about 3 p.m. So before we wrap up, I just want to thank each of our panelists once again for spending some of their valuable time with us and sharing their keen insights. Also, again, a big thank you to Delos, our partner, for this informative session. And last but not least, thank you to the many attendees who joined us today. I think I speak for many of us when I say I'm looking forward to traveling again, staying at hotels, dining with friends, and seeing industry colleagues at industry events. And hopefully, that's going to be very soon. In the meantime, stay positive and stay well. Thank you.
Thank you.
Thank you.
Thank you.
Thanks.